Jerry Brown, you're a physician assistant and a certified diabetes educator here at the UT Health Science Center. Thanks for joining us today.
Thank you.
Topic is insulin resistance, and we always like to start these off with definitions. So what is the definition of insulin, and what role does it play in the body?
Insulin is a hormone that is secreted by the pancreas. Its role in the body is to help move sugar or glucose from the digestive tract as it's ingested into the various tissues that it's used by, the muscles, the fat, the smooth muscles.
We're talking about insulin resistance, so with having defined insulin, what is insulin resistance?
The body normally produces insulin all the time. It's called basal insulin. When you eat, you require more insulin to break down that glucose. Insulin resistance is where more and more insulin is required in order to move that glucose from the bloodstream into the cells that use glucose.
What causes insulin resistance?
Many different things. One is there's a genetic predisposition to insulin resistance. Individuals whose family has type 2 diabetes are much more susceptible to insulin resistance. The other is our sedentary lifestyle. We don't use our muscles as much as we used to when we were kids. The other is obesity. As we grow more obese, our body has to use the sugar more efficiently.
So you may have partially answered the next question. Who is at greater risk for developing insulin resistance?
Well, certainly individuals who have a family history of type 2 diabetes, whose parents, mother, father, or siblings that have type 2 diabetes, and those that are obese, those with a waist circumference, men greater than 40 inches, women greater than 35 inches, those that are sedentary, that do not get out and move, the typical couch potato.
What kind of health problems will insulin resistance cause?
Ultimately, insulin resistance will cause type 2 diabetes to develop. It may be 10 to 15 years down the road from when insulin resistance first developed, but type 2 diabetes is associated with a higher cardiovascular risk. Individuals with diabetes have the same risk of having a heart attack as one who's already had a heart attack. It's also a player in kidney disease, peripheral neuropathy, digestive problems.
Do all people with insulin resistance automatically have diabetes?
If left unchecked, they can develop diabetes. However, you can reverse insulin resistance by simple things such as lifestyle change, diet, exercise, getting off the couch. Decreasing caloric intake by about 500 calories a day will cause you to lose about a pound a week. Exercise, 30 minutes of just simple walking per day, 5 to 7 days a week, will also improve your chances of not developing diabetes from insulin resistance.
What are the symptoms of insulin resistance?
Early on, there aren't any. It's just insulin is much higher and you don't feel the change. Later on, as you start developing diabetes or prediabetes, you may notice some vision changes, there may be some fatigue, thirst, increased urination.
How is insulin resistance diagnosed?
Primarily through blood tests. We'll look at glucose levels, both fasting and non-fasting, and to see if it rises above the accepted normal. There's not a specific test other than doing some basic laboratory type tests to include insulin levels to diagnose.
Once you have a diagnosis, how do you treat insulin resistance?
There are medications that we can use. Metformin is one that has been around for a long time that does help with increasing insulin sensitivity. It also has a little bit of an appetite suppressant with it. Other things are diet, exercise, getting off the couch, decreasing the amount of foods that you're eating.
You've touched on this already, but let me ask it as its own question. Are there lifestyle choices that you can make or things that you can change that will reduce your chances of developing insulin resistance?
Some lifestyle changes including exercise, 30 minutes a day, 5 to 7 days a week. Also the foods that you eat. Foods that are high in glycemic index, such as white bread, rice, potatoes, can increase the body's need for insulin, thus causing the pancreas to try and produce more just to keep up with the increased blood glucoses. Other foods that are low in glycemic index, such as wheat bread, nuts, vegetables, can lower your need for insulin.
You've now touched on this. What food should I eat more of, and what foods should I avoid if I suffer with insulin resistance?
White bread, rice, potatoes, things like that are much harder on your system and will raise your blood glucose. Low glycemic index foods such as whole grains, fruits, nuts, vegetables will help to lower glycemic index.
Let's talk about kids. Children develop insulin resistance?
There was a study done in San Antonio several years ago of 3rd and 4th graders who were at high risk for developing diabetes. Both their parents had diabetes, they were overweight, they were sedentary. They found that they had normal blood glucoses, however, when they measured actual insulin level, it was much higher. They were already on the road to developing diabetes.
Can insulin resistance be reversed or cured?
It's difficult to say that it can be cured, but at least it can be, the effects of it can be reversed with simple things such as diet and exercise. Again, those are the mainstays. Studies after study after study has shown that diet and exercise is as potent a treatment for both diabetes, metabolic syndrome, insulin resistance as any medication that can be prescribed.
Jerry, thanks very much for your time today.
Thank you very much.